Hi, I'm Dr. Rahul Gupta, interventional cardiologist at Apollo Hospital, Navi Mumbai, and I'm in conversation with PharmEasy. Together, we are going to discuss the best practices for good heart health. It's a good question whether waist circumference affects our heart or not. So there's a concept called as thin obese Indian. Now what does this mean? A person who looks thin but actually he is obese also. So it's in a contradictory sentence. But if you look at the waist circumference, so there are thin people who would be looking completely thin, their weight would be completely okay, but they would have that abdominal fat. Their waist circumference would be slightly higher, that abdominal paunch which is coming out. Now this fat is called as visceral fat, and this visceral fat is really dangerous because it's the marker of inflammation. Somebody who's got a visceral fat, a tummy which is a little fat, he may be thin, but actually he is at more risk, 7 times more risk than a person who is smoking a pack of cigarette every day, because this visceral fat is indicative of metabolic syndrome inside the body, and it's an inflammatory marker, and it predicts that a person can have future heart disease. So waist circumference is extremely important, and keeping this visceral fat in check will prevent you from heart disease. Now the cholesterol values have been changing. Historically, previously, a cholesterol of 160 was also considered as to be normal, the LDL. When we talk about the cholesterol, I'm talking about the bad cholesterol. Bad cholesterol is LDL cholesterol. But as we have seen that heart disease can occur even with that kind of cholesterol level, so the present guideline says that the cholesterol value has to be, for a normal individual, less than 100. But if somebody has already developed a heart disease, it should be less than 70. A diabetic patient should have LDL less than 70, because having diabetes means already having suffered a minor heart attack. So we want to keep the LDL cholesterol extremely low in these kind of cases. And somebody who has suffered recurrent heart attacks and have got multiple blockages, these days the guidelines are that we should keep our LDL as low as less than 50. If you look at the population, the tribal population, if you look at what LDL cholesterol we have at birth, it's around 35. And it has been found in the population where the LDL is kept less than 50, they do very well, they don't develop heart disease. So this is the levels of LDL cholesterol which all of us should maintain.